Everyone, this is Selena Belisle, the founder and one of the instructors at CE Institute. And today I'm going to talk to you about cryotherapy and give you some cryotherapy applications that you might be able to use in your practice. Normally we teach CE hours for the massage, bodywork, and cosmetology industries, although we have many physical therapists, occupational therapists, acupuncturists, chiropractors, and so forth in our classes, because this is pretty valuable training that you could use almost on a daily basis, and we hope you'll be able to enjoy. Today in review, we are going to go over the cryotherapy article that was recently published in Massage Magazine. Jacqueline Tibet, who is one of the other instructors at the school here at CE Institute, wrote this article with myself. It's published at massagemag.com, and it's called Cryotherapy, Effectiveness and Application in Massage Therapy. Although you can use these cryotherapy approaches in your PT or aesthetics or cosmetology services as well. Now, why would you use cryotherapy application specifically as a massage therapist? Well, many times when a client has swelling or contusions, bruising, acute injury, massage or physical manipulation of the soft tissue, anything that would include pressing or pulling on the tissue, that would likely be contraindicated. So what are you going to do when a client shows up to your office and they're contraindicated for soft tissue manipulation, and that's what they were scheduled for? You could probably apply cryotherapy applications instead of refuse treatment to that client, okay? It might not be as long of an appointment as what the client has scheduled with you. If they scheduled an hour-long service, usually cryotherapy can be achieved in about a 10 to 20-minute application, so it's usually shorter. And what you charge for cryotherapy applications would be up to you. So there's many different cryotherapy applications that are easily accessible and available to practice. These include ice massage, using cold pack applications, and even cold water baths or cold stones. Cryotherapy is an age-old medicine. It was first documented in use by Hippocrates, who is our father of medicine. And the more recent application, Sebastian Kneipp, was born in the early 1800s, and he used cold water baths for many different medical treatments. If you go to kneipp.com, it will give you a little overview of Sebastian Kneipp and his story. He's no longer alive, obviously, being born in the early 1800s, but he used cold water baths and hydrotherapy and aromatherapy, plant materials, to treat medical disorders and dysfunctions, such as consumption, tuberculosis, and those types of things. So he was a very well-known practitioner. He was originally some form of clergyman, and in his religious order, he wanted to do a little bit more than prayer. He introduced these other alternative methods, and he was able to help several of his followers to improve their health. And that's kind of what you're trying to do today, is use your cryotherapy applications to help people feel better, right? So the first thing that I'm going to review with you is ice massage. Now, a lot of people hop all over me when I talk about ice massage, because I know there's a lot of medical practitioners out there that are saying, oh, don't use ice, right? They were told either in college or university while they were studying for their MD or whatever that ice is harmful. I believe this to be highly inaccurate. I want to give you the example of LeBron James. Okay, LeBron James is one of the best athletes we have of all time while I'm recording this video about cryotherapy today. And if you look, LeBron James, not only is he covered in ice packs and in an ice bath for his feet alone, but he also takes ice baths and so forth. Ice is a wonderful modality when it's used properly. Now, you want to limit exposure when you're applying ice, because this can equally harm or burn the tissue. But I use LeBron James as an example because this is an athlete who could have any medical care in the world. Price is not an issue for LeBron James. If he wanted $1 million treatment after his game, I'm sure he would receive $1 million treatment if he needed it. In this case, he doesn't use physical manipulation from a therapist or a practitioner. He simply is using ice, which is wonderful. Ice can help with inflammation. It's great for post-athletic treatment. And I have to tell you, for those of you who don't know me, I am a 3-time WAF World Arm Wrestling Champion. My first competition was in the Athens Olympic Stadium in Athens, Greece in 1989. That's where I won my first world championship. And I've spoken to physicians who have done hip replacements, orthopedic surgeons and so forth, who have said, oh, let's not ice this. And I've asked them, well, what is your athletic experience, especially when working with professional athletes? And they have none. Their athletic experience is what their professor told them at college or university. And to me, that's really discouraging. I think that they're kind of throwing the baby out with the bathwater on the ice massage or ice applications, cold pack applications, when they say don't practice this. I think cryotherapy needs to be used responsibly. So there's a huge faction of population that says ice injury, and then there's a huge faction of population that says don't ice. I'm one of those populations, the factions that says ice and cryotherapy can be quite helpful. That's through my own experience and working with many professional athletes. I know what RICE is. RICE is that standard treatment of rest, ice, compression, and elevation when you have an injury, usually like somebody who's twisted an ankle or sprained their wrist or something like that, right? Very simple. If it's not with excessive bruising or pain to require emergency room treatment, we usually follow the RICE protocol at home for ourselves personally, right? Well, what do you do for your client who comes to your office with that strained ankle or some type of other traumatic injury? Maybe it's several days post car accident. They've already been to the emergency room. They've ruled out life-threatening conditions, but their back is spasmed and they have swelling. Well, you're not going to heat that. You're going to ice it, because you would never apply heat to swelling, but you can apply ice. Okay. In ice massage, what we like to do is I usually do like a Dixie cup, and I have these frozen in the freezer and ready to go if I'm in an establishment. And you just, after you freeze the water up to about maybe half an inch from the top of a Dixie cup, you would just tear off the top of that Dixie cup and then just do small circular movements around the injured area. As long as the skin is intact, if it's somebody recently had surgery, you wouldn't do this over a fresh surgical incision. There has to be a decent amount of skin proliferation and healing prior to doing ice massage over that area. Okay. Ice massage, they have a lovely picture of it here in the Massage Magazine article. This appears to be an ice cup, and they're using a towel to hold the ice because it can be quite cold. You're not going to be able to hold it with your hands. And you're going to do those circular movements. Keep the ice moving. If you keep ice in one area without movement, you're likely going to burn the tissue and create necrosis and injury. Okay, the other thing with ice massage is it can be really uncomfortable when you first start the application. You keep it in a very small localized area. And with ice massage, this is something after a couple minutes of extreme discomfort, probably more discomfort than what they were already feeling to initiate the treatment to begin with. After that couple minutes of extreme discomfort, usually comes numbness and complete pain relief. And to me, this kind of stops that pain signal going on in the body that's just lighting up all the nervous sensation, the central nervous response, that pain stimulus. It's just like, oh, let's throw more swelling at this, try and heal this injury. You're kind of just shutting all that down and giving your body a temporary relief from that pain. It's a natural, non-invasive, non-pharmacological way to shut down that pain stimuli within the body. Now, if somebody has acute pain that's not relieved by ice and it looks like a soft tissue injury, but you're icing the area and no numbness is occurring, and the matter of fact, their pain is getting worse, I might refer that individual to for emergency room treatment. We've seen cases where people have ruptured their appendix and they're in the office for low back pain or something of the sort. It's actually not low back pain. Ben Benjamin spoke last year in one of our classes about a client who thought they tore their rotator cuff again, but wasn't recently diagnosed with a new tear. And upon his suggestion that he needed a diagnosis prior to working on the client, that client went to his primary and they did some further up in diagnosis and investigation as to why they were feeling pain. The client had lung cancer. It was not a torn rotator cuff. Okay, so when somebody has undiagnosed pain, we definitely don't treat this. We need a diagnosis as to why they're in pain. And if we're treating the pain with something like a cryotherapy application and it's not being relieved but worsened, you should refer that individual back for emergency medical care. There might be a greater medical crisis that's not diagnosed yet or has a new onset. So ice massage is a great application. Of course, you can do the cold water baths like LeBron James. This is a little bit more aggressive. I would only use something like this in a professional athletic situation because it can be quite torturous. I like contrast baths of going back and forth from ice to a warmer bath. You're not going to have something really hot, hot, hot in an ice bath. Even if it's lukewarm, that's going to feel very hot compared to the ice bath. And I like doing smaller areas of the body when it comes to cold water baths. And that might be just like a bucket for an ankle or a foot or an elbow. And you can either do the ice bath application for it or contrast it back and forth with a warm water bath and an ice bath. Now you can also do cold pack applications, but usually I like to practice either contrast bathing or ice massage in my body work practice because anybody can apply a cold back at home, right? So we want to do things that a client isn't necessarily capable of doing at their own home, because why make the appointment and pay the money to see you if they can do it themselves? But I want to give you some nice cold pack options of how you can make cold packs if you don't necessarily want to use ice. Something that's still cold and considered cryotherapy, but it's not using ice, okay? So one of the ways you can create a cold pack, you wouldn't massage with this, but this is something that you could lay on the body while doing therapy in another area or just allowing the client to relax with the cold therapy. You can take a clean sock, maybe a new sock that's freshly laundered. You can pour rice into it, tie the end of the sock with a knot and put that in the freezer to chill it, and voila, there's your cold pack. You can also take a Ziploc bag, pour dishwashing detergent in it. It doesn't matter if it's antibacterial or the brand, it really doesn't matter. You would usually put this into 2 Ziploc bags to prevent leakage, and again, throw it into the freezer. That dishwashing detergent will not freeze, but it'll give a nice gel moldable feeling to wherever you're going to apply it on the client's body. It's also usable, so you can use that once the plastic bags have worn out or what have you. You can simply use it to wash dishes or hot stones or whatever else might be in your practice. Maybe you're doing cupping, you can use your dishwashing detergent. And now you're being more eco-friendly and leaving less of a footprint in the environment by making your own cold packs. Another thing that you can do to create a cold pack of your own without buying those chemical prepared cold packs are, you can take things like wet sponges and you can either put this in water or rubbing alcohol and put it in a Ziploc bag. It's not going to be as conformable as the liquid dish detergent, but it is another way you can do a cold pack on a client's body. And of course, you can use things like a bag of frozen peas. But again, this is something a client can do at home. So I advise more the contrast baths and ice massage if you're going to use cryotherapy in your practice. How cryotherapy affects the body? It usually affects the body by decreasing circulation. Okay. And if you have swelling and the body is continuing to swell with injury, that additional swelling is creating secondary injury in addition to whatever created the trauma in the first place to result in swelling. What happens is the soft tissues can swell and swell and swell and start to stretch beyond their normal range of motion and even tear. That's why it's called secondary injury. So our goal is to reduce the swelling as quickly as possible, and a great pharmacological, non-invasive way to reduce swelling instead of trying to take opioids or Lasix or any of these other things. You can simply use ice and cryotherapy, other cold packs and so forth. Now, there is several studies out there that show that cryotherapy can decrease swelling and hemorrhaging to an area. And believe it or not, too much ice could actually create tissue death, necrosis. So it's very important that when you do your cryotherapy applications, it's done so with proper training, which would be above and beyond what I'm sharing with you today. You would probably go on and take some classes in cryotherapy application. And hopefully that will give you more of what you need to apply some of these sciences. Now, there are many different theories as to why cryotherapy relieves pain. There's a pain gating theory that we discuss in this article. Also, it's important to know that in your cryotherapy application, we think one of the things that's happening is that when you're receiving that nervous stimuli that creates that pain sensation in the central nervous system, we think of applying cryotherapy actually overtakes that other stimuli. And all of a sudden, now you're processing the coldness application. And it's actually, in my opinion, trying to create a situation where the tissue can survive through that cold application. And the brain is no longer thinking about pain, it's thinking about survival. And that's my lay explanation and understanding in some of these theories. In cryotherapy application, our goal is to decrease pain, tissue inflammation, swelling, and metabolism. We're trying to decrease that blood flow. But sometimes when you apply ice, you'll see that the skin reddens. Well, how does that happen? If you have decreased circulation, why is it now red, right? Jacqueline has described this in our article about the hunting response. And the hunting response is the body using these capillaries to rush blood flow to the area. And it's a small amount of blood flow. It doesn't make up for all the tissue blood circulation that's being decreased, but a small amount of blood flow is sent to the area through this thermoregulator area of response, and that's the reddening that you're seeing. It's not like an increase of circulation to the area. There's something that instead is called the hunting response that's creating that reddening. Now, most of the people who are taking this course are massage therapists and other practitioners that apply soft tissue manipulation to the human body to relieve pain and improve function. Well, I have to tell you, it's not a great idea to apply cryotherapy with soft tissue manipulation. It's almost contraindicated. And that's because when you apply cryotherapy, the one thing that happens is you have a decrease of soft tissue compliancy. Okay, so while we have hydrotherapy, warm heated thermotherapies that could elongate the tissues and create collagenous changes and improvements that increase pliability. With cold and cryotherapy, there's actually a decrease of soft tissue compliance and pliability. So if you try and stretch your athlete or client or whoever you're working on after cryotherapy application, it's very possible that you could stretch and tear a tissue because the tissue is now less compliant, less pliable. It's not advised to do cryotherapy and then soft tissue manipulation. I know it's nice to be able to do the cryotherapy to relieve pain before doing soft tissue manipulation. That's a great way to work on somebody without causing greater pain to them, but stretching the tissue and hopefully relieving any type of muscular restriction, scar tissue, fibrosis, and so forth. But you shouldn't do this if swelling is present, because we should never be pressing into swollen tissue anyway. And keep in mind that the cryotherapy application is going to make those fibroses and adhesions probably even tighter and more contracted. So if you want to do soft tissue manipulation with cryotherapy, do it before. And after you do your soft tissue manipulation, which may cause a little bit of swelling when you're stretching and working on fibrosis and adhesions and restrictions, you can do your cryotherapy applications afterwards. Okay, we have quite a few notes. Jacqueline went through and pulled a bunch of articles published in Science about cryotherapy application. If you want to review these further, they're at massagemag.com. And the article is again called Cryotherapy Effectiveness and Application in Massage Therapy. Okay, and all of this is there published online for you to view. We think that cryotherapy is a great application, but there are some contraindications for some clients with various medical conditions, such as circulatory insufficiency, cold allergy, advanced diabetes with neuropathy, and so forth. Make sure if you are going to practice cryotherapy modalities that, again, you get sufficient training in cryotherapy applications prior to practicing to ensure no harm and make sure that your treatment has an efficacious result. So my name again is Selena Belisle. I'm here at CE Institute. Our website is ceinstitute.com. That's CE as in continuing education. So ceinstitute.com. We teach on a variety of subjects, and we hope to see you in one of our trainings at the school, either live online or in person, or one of our other pre-recorded courses. Thanks so much for watching about cryotherapy today, and until we see you in another training, be safe.